Hello and welcome to the COMLEX Instant Review. Please visit www.comlexflashcards.com for complete COMLEX prep resources as you prepare for the COMLEX board exam, and also subscribe to our blog, which will give you daily updates for medical school and for the board exam. Let's review COMLEX Orthopedics. Today we're going to be focusing on the hand. 45-year-old female presents with pain, tingling, numbness, and intermittent weakness in her left hand that has been present for the past several months. She's concerned because the symptoms, which initially occurred only at night, are now occurring during the day and are interfering with her profession as a classical violinist. What is the most likely diagnosis? So in this question we have pain, tingling, numbness, intermittent weakness. It's been going on for several months. And the key here is they initially occurred at night but are now occurring during the day as well. And her profession is also going to help us make the diagnosis. Is it bursitis, carpal tunnel syndrome, decovariance tenosynovitis, medial epicondylitis, or thoracic outlet syndrome? The answer here is pretty straightforward. It's carpal tunnel syndrome. Carpal tunnel syndrome is the most commonly encountered entrapment neuropathy of the hand. Patients have pain, paresthesias, weakness in the distribution of the median nerve. And that's important to know. It's the median nerve. As you can see in this diagram, there's the flexor tendons, and the median nerve is situated very closely to those flexor tendons. The carpal tunnel, as you can see on the diagram, is right below the transverse ligament. And it's important to understand the area of the numbness. It's the region of the thumb and the first and second metatarsal, and a portion of the third metatarsal. Typically occurs in middle-aged women with symptoms often presenting with bilaterally, and then there's an insidious onset and slowly becomes more progressive, as we have in this case. Anything such as repetitive motion, trauma, pregnancy, obesity, gout, and hyperthyroidism are all predisposing factors. Patients will have a positive Tinel sign, a Phelan's maneuver, and also will show signs of numbness and tingling on carpal compression. The treatment here is wrist immobilization, rest, and NSAIDs. And so on the board exam, you can be asked most likely about one of the tests, such as the Tinel's test and the Phelan's maneuver, and how do you treat it. The key answer here is wrist immobilization, rest, and NSAIDs. Let's review some of the other topics. Decovariance tenosynovitis. Here you have inflammation of the extensor pollicis brevis and abductor pollicis longus tendons on the side of the wrist at the base of the thumb. And there's also a positive Finkelstein's test. In the medial epicondylitis, also known as golfer's elbow, there is inflammatory and degenerative changes at the medial epicondyle. Patients have discomfort of the medial elbow, and it's associated with symptoms of ulnar neuropathy. Keep in mind that also thoracic outlet syndrome. Thoracic outlet syndrome is compression of the neurovascular structures in the thorax. And there's pain and paresthesias in the ulnar nerve distribution, and also trauma and repetitive activities can lead to thoracic outlet syndrome. But again, based on the patient's presentation, it was easy to make the diagnosis of carpal tunnel syndrome. Let's review another question. Avascular necrosis is commonly associated with what type of fracture? Colles fracture, lunate fracture, mallet finger, Smith fracture, or triquetral fracture? Again, the answer here is the lunate fracture. And it's important to understand the different fractures of the hand as you're reviewing for the board exam, because these are commonly seen in practice and they may be asked on your boards. So the lunate fracture is rare, but again, understand that there can be an isolated lunate injury. Usually it's the result of a fall on an outstretched hand, and that's very classic. So if you see that on the boards, you should immediately think about a lunate fracture. And again, it leads to avascular necrosis, also known as Kienbach disease, and can lead to lunate collapse, osteoarthritis, and weakness of grip strength. Let's review some of the anatomy here. You have the pisiform, and then you have the lunate, the scaphoid, the triquetrium, hamate, capitate, trapezoid, and trapezium. So it's important to keep these in mind And generally, you can look at several other bones that are important, such as the scaphoid bone, but in this case the answer is a lunate fracture. Let's review another exam question. Which of the following immobilization methods is indicated for a non-displaced scaphoid fracture? Is it long arm volar splint, short arm thumb pike spica splint, sling alone, no splint required, or ulnar gutter splint? And so it's important to understand the various types of treatments for a common type of fracture such as scaphoid. In this question, it's a non-displaced fracture. And so because it's non-displaced, you want to go for a short arm thumb spica splint. The scaphoid fracture is the most commonly fractured carpal tunnel bone. And again, this also occurs when there's a fall onto an outstretched hand, and up to 15% are not seen on initial x-rays, and there is again a risk of avascular necrosis. And it's usually considered to be treated with a spica splint, and that's the key answer on the boards. That was a review of some of the common scenarios for orthopedics, especially in the hand, that we may see on the COMLEX board exam. Please visit comlexflashcards.com and subscribe to our blog, and you can use the search box to search for various medical topics that may show up on your board exam. Good luck in your preparation.